Hello to all of my talented and dedicated colleagues. I'm Jean Folks, and I want to talk to you very briefly about the enormous value I find in EFT, augmenting the scope of my clinical work. I just celebrated in June my 35th anniversary in practice, and all of those 35 years I've dedicated to the treatment of psychological trauma, PTSD, and dissociative disorders. Throughout those 35 years, I have amassed a really large tool bag, including Ericksonian hypnosis, metaphor work, narrative metaphor, Gestalt, CBT, DBT, of course EMDR. I am a EMDRIA-approved EMDR consultant, and EFT, Emotional Freedom Technique, or also known as meridian tapping. And I have found that EFT has boosted my use of other techniques in my practice, all of which I still continue to use, in a dramatic, profound, and liberating way. And I want to share that with those of you in the trenches, looking for ways to find the somatic way in to your most difficult clients' traumatic struggles and barriers, to find the way to help those people that we slog with to break through their glass ceilings of negative cognitions and doubts. There are 3 options that I'm offering this fall. The first is my introduction to EFT for licensed clinicians. This is the workshop that will help you learn how to teach your clients EFT in the most streamlined, safe, and effective way possible, and to begin integrating EFT in strategic ways into the work that you're already doing with your clients. The second option is the more advanced EFT training that I offer to licensed clinicians that is specifically dedicated to trauma applications for EFT. In that workshop, we'll be learning how to work directly with traumatic memories, how to do that safely, incrementally, and again, integrating it with the other techniques that you are already using and certainly don't want to abandon, but to make those techniques even more effective. The third option really has 2 parts to it. I will be starting a case consultation group on the second Friday of each month, starting in October and running through April. And that will be a 7-session series to bring your most difficult cases, your most challenging cases, your ethical questions, and your clinical conundrums to a group experience where we will share our collective wisdom and try to find creative solutions to your greatest clinical challenges. And then, of course, I always offer private individual case consultation that can be tailored to your specific needs. All of this can have EFT included as part of the work, but for the private work, if the EFT is not your thing, we can still do case consultation around the techniques that are most meaningful to you. So I hope you will consider training with EFT and learn how to integrate it into a dynamic trauma treatment tool bag to make the most of what you're already doing and have a new somatic treatment technique to make your work even more profound. Thanks. Everything is listed below in the newsletter, all the dates and times. Absolutely, if you have any questions, feel free to call me directly and I'll be happy to speak with you. I'll see you soon.